Welcome into HospiNews, updates about hospitals and healthcare sector. Cataract operation is being performed on President Droupadi Murmu at the Army Hospital in Delhi. A spokeswoman for the Rashtrapati Bhavan stated that President Droupadi Murmu had surgery to remove his cataracts on Sunday at the Army Hospital Research and Referral in this city. According to the statement that he released, the operation was a success, and she has already been released from the hospital. On July 25, 2022, Murmu, who was 64 at the time, was sworn in as the 15th President of India. Quote. Today, Murmu had surgery to correct his cataracts. The procedure was a success, and she was released from the hospital shortly after, the report stated. After MBBS in Hindi, now it's turn for Tamil language. On Tuesday, the Lieutenant Governor of Puducherry, Tamilisai Soundararajan, made the announcement that the territory government has plans to open a medical school that will offer an MBBS program in Tamil. She told the media that she will speak with Chief Minister Rangasamy about the logistics of building a medical school that will teach in Tamil after she had taken part in a ceremony commemorating senior folks. The ceremony honored those who have lived a full life. She made the announcement that the development of Tamil medical textbooks will be the responsibility of a new committee. She stated that neither the Prime Minister Narendra Modi nor the Home Minister Amit Shah were attempting to impose a specific language on the general population. She used the Prime Minister's words as an example. Dhanteras Celebrations in MP medical colleges on cards after introducing Hindi medium books for non-clinical subjects. The Puja of God Dhanvantari, often known as the Lord of Health, will be performed at all of Madhya Pradesh's medical colleges on Dhanteras, which is a part of the Diwali celebration. According to the State Medical Education Minister Vishwas Saring, who made the announcement on Tuesday. On Sunday, the Hindi translation of the MBBS textbooks was made available to students in Madhya Pradesh. This is an important development. According to Mr. Saring, Dhanteras would be celebrated with great fanfare in medical institutions throughout the state on an annual basis in a manner similar to the Ganpati festival. He explained that the purpose of holding the Dhanvantari Puja in medical schools is to work toward the goal of making Madhya Pradesh a healthier state. By paying homage to Bhagwan Dhanvantari, we offer prayers for the well-being of ourselves and others around us. The festival of Dhanteras, which will take place on October 22 this year, will be observed by all of the state's medical institutions in the form of a program dedicated to the worship of God Dhanvantari. Mr. Saring informed reporters that all medical professionals, students, and those who care for patients will take part in the event and pray for the well-being of everyone. He stated that one of the beliefs held by Hindus is that God Dhanvantari is an avatar of Lord Vishnu. According to Mr. Saring, the celebration of Dhanteras will be celebrated with the same level of pomp and circumstance as the festival of Ganpati every year in medical colleges. It is said, prevention is better than cure. According to the findings of a systematic review and meta-analysis that was published in the Lancet Microbe, preoperative skin preparation with either chlorhexidine in alcohol or olanexidine is the most efficient method for reducing surgical site infections. Researchers from Amsterdam University Medical Center in the Netherlands looked through publishing databases up until November 2021 in search of research that evaluated SSI prevention measures. A total of 33 studies were chosen for inclusion in the systematic review. And of those, 27 were also included in the subsequent meta-analysis. All of the studies that were considered for inclusion were randomized controlled trials in which various preoperative skin antiseptics were compared for their effectiveness in preventing surgical site infections SSI in adults. Adults who had surgical operations on wounds of varying severity. The incidence of surgical site infections was the primary outcome, which included superficial deep, and organ space infections. The studies that were taken into consideration looked at a total of 27 different types of antiseptic solutions. The 3 types of antiseptic preparations that were used the most frequently in the research were as follows: aqueous iodine versus iodine in alcohol N11, 2.0% to 2.5% chlorhexidine in alcohol versus iodine in alcohol N7, and 2.0% to 2.5% chlorhexidine in alcohol versus iodine in alcohol N6. In total, 17,735 individuals were considered for inclusion in this study. And of those patients, 2,144, 12.1% were diagnosed with an SSI. When compared with aqueous iodine, the researchers discovered that 1.5% olanexidine relative risk RR, 0.4995% confidence interval key, 0.26, 0.92 and 2.0% to 2.5% chlorhexidine in alcohol RR, 0.7595% confidence interval key, 0.610. 92 were both associated with an overall decreased SSI risk among patients with any wound. Classification. Regarding the occurrence of adverse effects, it was discovered that the various skin antiseptics that were put through their paces did not significantly differ from one another. Erythema, pruritus, dermatitis, skin irritation. Due to the fact that the usage of olanexidine at a concentration of 1.5% was only assessed in one of the studies that were included, it is possible that the findings pertaining to 1.5% olanexidine have been overvalued. The efficacy of olanexidine was proven by a single randomized study, and more investigation is required, the researchers stated. An author has disclosed relationships with many industry organizations. For a complete list of disclosures, please consult the source material that was originally cited. Brain ultrasound for future. The use of non-invasive brain ultrasound as a treatment represents a promising alternative to other types of brain stimulation modalities as well as pharmaceutical drugs. However, testing it can be difficult due to a lack of preclinical systems for chronic stimulation in awake animals. Despite this, the use of non-invasive brain ultrasound as a treatment represents a promising alternative. Researchers have recently devised a method to provide ultrasound stimulation to the brains of conscious mice while they are acting normally, as detailed in research that was recently published in the journal Advanced Science. The group put the technology to use in their investigation of how ultrasonic neuromodulation affects the quality of sleep as well as working memory. This development will also assist in the testing of various ultrasound treatment procedures in mice models of a variety of neurological diseases by other scientists. Ultrasound is an interesting method of neuromodulation. Due to the non-invasive nature of ultrasound therapy, there is a high potential for employing ultrasound to treat brain problems. According to the Korea Advanced Institute of Science and Technology's corresponding author Hyunju J. Lee, Ph.D., I have high hopes that our technology may one day be able to assist a large number of neuroscientists in investigating the therapeutic potential of ultrasonic stimulation. 6 individuals who were acting as middlemen and diverting patients away from Odisha's premium government hospital have been detained. The Maharaja Krishna Chandra Gajapati MKCG Medical College and Hospital is considered to be one of the best government hospitals in Brahmapur, Odisha. However, in a covert operation, the Brahmapur Police Department apprehended 6 middlemen who were funneling patients who were seeking treatment at the MKCG Medical College and Hospital to other private hospitals. The members of the police force went undercover by disguising themselves as patients and combing through the various departments in an effort to root out the middlemen. The police claimed that they had received a large number of complaints regarding the middlemen who were allegedly involved in each and every department of the hospital. The intermediaries would persuade patients and their relatives to either have treatment at a private hospital or charge an outrageous amount of money for virtually everything. In order to get their work done, the relatives of the patients had to pay a significant amount of money to the intermediaries. This included paying for the allotment of beds as well as CT scans. 6 individuals who were pressuring hospital patients to receive treatment at private hospitals or clinics or to have their tests performed at independent laboratories were apprehended by the police squad during their investigation. The patients were given misleading information by the middlemen, who told them that the government hospital lacked adequate facilities, and that in order to receive better care at MKCG, they needed to either pay a significant sum of money or seek treatment at one of the many other private hospitals in the area. A newborn that was found in a garbage can has since been treated at a private hospital and handed over to the Child Welfare Committee. The institution said that the infant has been feeding normally and is steadily putting on weight. Its current weight is 2.5 kilograms, after spending several days in the hospital. Representative image, Reuters. The institution reported that the infant has been feeding normally and is steadily putting on weight. Its current weight is 2.5 kilograms, after having spent 11 days in the hospital. According to the hospital, the newborn, who weighed about 2.1 kilograms, had a bite mark on her right thigh, had a low oxygen saturation, was hypothermic, and was damp. A baby girl who was found abandoned in a garbage can earlier this month and had a bite mark on her leg was turned over to the Child Welfare Committee on Wednesday after receiving treatment at a hospital in this city. According to the officials who made the announcement, after the girl was discovered inside of the garbage can, the officers from the nearby police station transported her to the emergency room of the private hospital. The infant was transferred to the neonatal intensive care unit, where she was stabilized after being there for some time. Her temperature was kept at a comfortable level using a baby warmer. Antibiotics were administered in addition to providing her with oxygen support, and her blood sugar levels were monitored and controlled. Fortis Hospital in Vasantkunj reported that the infant had anemia, which led to the initiation of treatment and the performance of tests regarding the condition. In addition, it was reported that she was diagnosed with a patent ductus arteriosus, which is the medical term for a persistent opening between the two major blood channels that led from the heart. This condition did not require surgery for treatment. After 2 years of the pandemic, reports show that medical tourism in India is on the rise. It is possible that the increase in medical tourism is to blame for the flattening of the third wave of COVID-19, the loosening of limitations, and the removal of government quotas on private institutions. The number of visitors from other countries increases, but they are still significantly below the levels seen in 2019 according to a report published by the Times of India. Medical tourism in New Delhi is booming once more after seeing a decline during the preceding 2 years. Patients are traveling from a variety of countries, including Bangladesh, Iraq, Uzbekistan, and Kenya. The majority of patients who travel to India do so in order to receive transplants of various organs, the most common of which are kidneys, livers, and bone marrow. It is possible that the increase in medical tourism is to blame for the so-called flattening of the third wave of COVID-19, the loosening of limitations, and the removal of government quotas on private hospitals. They had been frozen for more than 2 years at that point. Patients from other countries, particularly those suffering from life-threatening illnesses, or in need of orthopedic surgery or organ transplants, have started to be treated in hospitals. We anticipate that the number will continue to increase of people traveling for medical treatment. Dr. Sangeeta Reddy, who is also a joint managing director of Apollo Hospitals, shared this information with TOI. The percentage of people traveling to India for medical tourism was close to 33% throughout the years 2020-21. In the years 2021-22, it reached 50%. The first half of the year 2022-2023 saw it pass the threshold into the pandemic stage. However, after the epidemic, there has been a shift in the pattern of medical tourism. In the past, the majority of visitors coming from Afghanistan would make their way to Delhi. The number of patients has been decreasing ever since the Taliban took control of the country. The number of patients coming from Turkmenistan has decreased as a direct result of the difficulties associated with obtaining visas. On the other hand, the number of patients who can come from Fiji and the other Pacific islands is constrained due to the fact that there are fewer flights. That's all for today. You were watching HospiNews, news for hospitals and healthcare sector. Please subscribe our YouTube channel and click the bell button for new video to receive future hospital and healthcare related new video update from HospiNews.